Hello everyone. Today we have Dr. Ajay Kumar Gajengi with us. Thank you, sir.
Hello everyone. I'm privileged to have you myself on your talk. So, Mr. Dhawan, what's on?
Sir, before starting further, I would like to ask you what is and where is prostate?
Prostate is a secretory gland which is situated just below the urinary bladder. It is surrounding the urethra, what we call as the prostatic urethra. The main function of the prostatic gland is secretion of the seminal fluid, which is helpful in carrying the sperms from the testis to the exterior through the urethra.
So now we know what is prostate. So, sir, please tell us what is prostate cancer.
Now, any malignant tumor of the prostate is called prostatic cancer. It can be either low grade, intermediate grade, or high grade, depending on the biopsy findings, usually seen after the age of 60 years.
And sir, how common is prostate cancer?
Its incidence and mortality is increasing day by day, and it is expected that worldwide there can be around 17 million prostatic cancer patients by 2030.
So, what are the causes of prostate cancer?
Now, scientists have not been able to find what exactly is the risk factor or cause, but some etiological findings have been discussed, like age, family history, particular race like Africans and Americans. They have a higher tendency of prostatic cancer.
So, are some men more likely to have prostate cancer? Like some have more risk?
Yeah, as we have already discussed, age is one of the important factor. More than 60, 65, the incidence of cancer of prostate increases. Those who already have a family history, like in their first relationship, father, brother, even grandparents, they can have a risk of higher prostatic cancer. Also, it is said that those patients whose diet is mainly of animal fat, they also tend to have more prostate cancer. And those who have more of vitamins like fresh fruits and vegetables, they have less tendency of prostate cancer.
So, sir, are there any symptoms of prostate cancer?
Yeah, definitely. Most of the times it is asymptomatic. Sometimes it can be have symptoms like frequency of urination, blood in the urine, poor flow of the urine, that they have to strain while passing urine. There can be sometimes getting up in the night, what we call as nocturia, urgency. So, depending upon the spread of the tumor, if there is locally advanced cancer, there can be incontinence of the urine. There can be spread of the cancer to other parts, which can cause bone pains.
So, what are the other diseases which have same symptoms as prostate cancer?
Now, benign enlargement of the prostate, what we call as benign prostatic hyperplasia, also. This is non-malignant enlargement of the prostate. In this also, we have symptoms similar to prostate cancer like frequency, poor flow, urgency, nocturia. In infections of the prostate, what we call as prostatitis, can also have blood in the urine, frequency, urgency. All these symptoms can be mixed in all these three conditions.
Sir, as you said before, that prostate cancer can be asymptomatic. So, how do you detect the asymptomatic?
Basically, screening has to be done, and which is usually done in Western countries in all the patients, all the elder patients, means more than 50 years, more than 55, they have a criteria to undergo serum PSA levels and digital rectal examination so that the cancer is detected early even if it is present.
So, what is PSA test?
PSA is basically a blood test. It is serum test, means prostate specific antigen to detect prostate cancer. The rise in PSA level usually indicates cancer of the prostate, but this rise can also be in non-malignant conditions like benign non-malignant enlargement of the prostate and infections also.
Sir, if in the initial state prostate cancer is detected, what is next? What do you do further?
So if the cancer is detected, then we have to do advanced test to decide whether the cancer is localized, locally advanced, or metastatic. Depending on that, we stage the disease and then treat it.
And how do you treat the prostate cancer?
Now there are many modalities like surgery, radiation, hormonal therapy, chemotherapy. Depending upon the stage, depending upon the grade, depending upon the age and acceptability of the patient, condition of the patient, this treatment is given.
What are some types of surgeries you perform on the patient?
Now, surgery is usually given to patients who have localized disease, where the cancer is only limited to the prostate and not spread to other parts. In this, we do radical prostatectomy, in which the entire prostate is removed. It can be done either by open surgery or laparoscopic way or robotically also.
So what is radiation therapy for the prostate?
Radiation is basically a form of energy in which high beam X-rays are thrown to the cancer areas so that the cancer cells are killed.
And what is hormonal therapy?
Hormonal therapy is basically given to decrease the level of testosterone in the body. Now, cancer cells survive on testosterone. Hormonal therapy is intended to decrease the level of testosterone. It can be given in those patients who have metastatic, that is, the cancer has already spread to other parts of the body. So, to control further spread, we give hormonal therapy in them. In patients who have already undergone surgery, to decrease the residual prostate cancer, also we give hormonal therapy.
So besides all this therapy, there is something called watchful waiting. So what is watchful waiting?
Watchful waiting, a good question. Now, watchful waiting is given to those patients who have a stable disease, who are having a low grade, low stage, not progressing. So those patients are followed up strictly. So this procedure is called watchful waiting. In that, we do regularly serum PSAs, yearly biopsies. If the stage and PSA grade and PSA remains the same, we continue to watch them. But if it increases, then we have to treat according to the stage.
So all these treatments, and as we know, with good things, bad things comes, and side effects also comes. What are the side effects of these treatments?
Now, every treatment modality has its own side effects. Like it can cause decrease in the sexual desire, erection can be decreased, there can be incontinence due to surgery, there can be blood in the urine due to radiation, increased frequency of urination. Hormonal therapy has its side effects like anemia, like low hemoglobin levels. It can cause decreased bone density, easy fractures, heart disease also happen. So these are the hormonal side effects.
So what are the follow treatments for all of this?
Every patient needs to be under strict follow-up, whatever treatment modality they have been taking, like PSA levels every 3 months. If required, we have to do a CT scan or a bone scan, depending on the symptoms or stage of the disease.
So, can a man with prostate cancer survive?
Yeah, definitely. It is a curative disease. Now, after radical prostatectomy, patients live normally. Now, those patients who have metastatic disease with hormonal therapy and a combination of chemotherapy, we can see patients surviving up to 4 to 5 years also. So, the incidence of longevity is also increasing in prostatic cancer patients.
So thank you, sir. And lastly, do you have any advice for the viewers?
Yeah. So, those patients who are more than 60 years, I would like them to screen themselves, go to the urologist, get themselves screened by doing a blood test, that is serum PSA, and digital rectal examination. And also those patients who are having symptoms like frequency, blood in the urine, flow disturbances, they should also visit their nearby urologist, consult them, and seek what next is the option to detect prostatic cancer.
Thank you, doctor. It was very insightful to have you. Thank you.
Thank you, Dhawan.